If we could start, our mission at Aveda is to care for the world we live in, from the, to the ways in which we give back to society. At Aveda, we strive to set an example for environmental leadership and responsibility, not just in the world we live in, but around the world. I'm awake, but I have been awake since very early, so that's okay. I'm going to let you guys take it over. I'll let you take it over with an introduction.
Okay, excellent. Good morning, good morning. Perfect. Can y'all all hear me? Wonderful, because I'm not using a mic. All right, so just a quick introduction. My name is Stacey Bello. I am your neighborhood occupational therapy student. I've been here since November. You have probably seen me in a couple of different classrooms. I see a couple of faces that I haven't seen before, but hopefully I'll be able to meet y'all before I actually leave next month. So throughout my research on ergonomics and joint protection, I've heard some people complain about foot health and want to know a little bit more about foot safety. So I have invited Dr. Janice Kennedy, who is an advanced foot and ankle care specialist in Uptown Dallas, so not too far from here, probably about 10 minutes from here. She's going to come and talk to you about different aspects of foot and ankle care. She is a podiatrist. She went to school she did her residency out in New York, and she is a native of Texas, so she lives out in the Garland area. So she's very familiar with Texas. So I will let Miss Dr. Kennedy go ahead and have her introduction, but here you go, please clap.
Awesome. Hi, everybody. I'm Dr. Kennedy. Nice to meet you all. That was an awesome mission statement. That was awesome. Everyone knew it too, so very cool. All right, so this is where our office is, Fitzhugh 75. That's me. I won't bore you with details there. That is also our other doctor, so there's two of us. So, question, how are your feet right now? Not great? Say it again. So, you all have very long careers ahead of you, hopefully, bright futures. The nature of your work is you're probably standing for long hours, and your feet probably suffer. So we want to keep you upright and moving and working as long as possible. So these are just some tips to help keep your feet healthy. So ergonomics is a big part of that. So things you can do is avoid standing for long periods of time on floors like these. So if you can, sometimes it's unavoidable because you can't control your environment as well, but if you can get the anti-fatigue mats, that's a huge help because it helps absorb some of the shock, so it's not all going through your feet. Other things you can do is wear good shoes, so we'll talk about that as well. Compression stockings is a big one. That helps keep your veins healthy, and it helps reduce swelling at the end of the day. So you can get them on Amazon. Literally, you can get any color, you can get cute ones, but it's really helpful. When you take a break, if you're at a lunch break, just like you're doing, like elevating your legs, that's awesome. Just helps to reduce swelling. So highly recommend that. And then we'll talk about arch support orthotics as well. Breathable materials. So if you're buying your shoes and your socks, try to get more natural fibers. Plastic shoes, plastic socks, those aren't as healthy. Sometimes you can get a rash, allergic reaction, and it can be from your shoes or your socks. So that's important as well. So let's talk about shoes. What kind of shoes do y'all have on? I see different kinds. Actually, I see a lot of good shoes. So this is what we're going to talk about. Does anyone wear high heels? Okay, so y'all are ahead of the curve. So high heels, 71% of women say they're very painful, which is no surprise. If you have to wear a heel, like for a dress, you know, a special event, you want to try to get a lower heel if possible, less than 2 inches. If you can get one with ankle support, like a bootie, like an ankle boot, that will give you more support. But in general, we recommend not wearing heels. Heels are not the only bad shoes. There's also other bad shoes that look like normal shoes. So any shoe that you can take the heel and the toe, so I'll take mine off right now. All right, so if you take the heel and you take the toe and you can bend it, it should bend at the big toe joint here. If you can take your shoe and make a taco, it's not a good shoe. You're not getting support. So I know there's a lot of trends with the barefoot shoes, the mesh ballet slippers, even Skechers. So even if it looks like a normal tennis shoe, but if you can bend it into a taco, you're not getting any support. So I want you all to be investigators, be your own Sherlock Holmes. You don't have to buy a specific brand of shoe or a specific style, but you have to evaluate for yourself when you go shoe shopping for a good shoe. So let's investigate some shoes. So first, these are the different parts of a shoe. So the toe box is that first part where your toes go. It's just that cap of the shoe. And then the outsole, the midsole, that's that bottom part of the shoe. So focus on those. All right, so is this a good shoe? No. Why is it not a good shoe? It's a heel, yep. So that steep slope. Any other reasons why it's not a good heel? Pointy. Yes, the toe box is too small. You're right. So first, the toe box. First, the steepness. So that's an X-ray of somebody in a high heel. So if you look, the ankle is actually in a what we call plantar flex position. So that is not a good position. It's not stable for your feet. And it can lead to injuries. You're more likely to roll your ankle or sprain your foot. So that is not a good shoe. So this is an example of a better shoe. So as you mentioned, the toe box. So that's a bit more rounded. It's a lower heel. The picture on my left has a T-strap. So anything that can wrap around the ankle and give you more stability is good. If you look at the heel with the stacked heel, that's more stable than a stiletto. So those are all things you can do differently to make it a better shoe. All right, how about this shoe? Is this a good shoe? It's a flat. Why? Very good, awesome. Yes, there's no outsole, there's no arch support. Also, we mentioned the pointy toe box. So for the toe box, do you see how the foot is fitting in the shoe? The pointy one, it's like you're cramming your toes into a shoe that isn't made for human feet. So keep that in mind, that a lot of issues, especially to the toes, you can get calluses, blisters, a lot of different issues. So to avoid that, make sure your toe box is more rounded. All right, let's talk about the arch. So you do want a little bit of a heel, not more than 2 inches, but a little heel is good because you have a natural arch, as you can see in the bones picture there. So you want to support your natural arch. All right, so here's some examples of good shoes. So like any kind of loafer with a little heel, and remember you want to just test that shoe to make sure that it's a actual support. Okay. All right, so where can you go buy shoes? Online, there's a place called OrthoFeet. There's also running stores, Luke's Locker, Fleet Feet. They have people there that'll help you measure your shoe size and help you buy a good shoe. But like I said, you just want to evaluate the shoes yourself. That's more important than buying a specific brand, because what feels good to my feet may not feel good, may not be a brand that shape works for you. So just keep that in mind as well. Does everybody know their shoe size? How do you know if you're wearing the right shoe? They're too big? So too big is also a problem. Too tight, too small is a problem. Too big is a problem because your foot can slide. So that's glad you're picking up on that. That's good. Every once in a while, you do want to have someone measure your foot. So we have a device. Your podiatrist can do it, the doctor's office. Shoe stores sometimes have it as well. So you just want to know. And also, sometimes some people have one foot is one size and the other foot is a different size. So people that are born with deformities, clubfoot deformities, or have had surgeries, different reasons, or just have two different size shoes. So Nordstrom has a policy where you can actually buy one size shoe and another size shoe, and they charge you for the one pair of shoe instead of buying two pairs. So if you have an issue or you know someone that does, that's a good policy. Similarly, Zappos, they also have different shoes. So if you know anyone or yourself has a disability, maybe you can't lace the laces, so they have zippers that go all the way around the shoe or different things. So that helps as well if that's something you know someone that has an issue with. All right, so most common things that a foot and ankle doctor sees, why people come in to our office. Number one thing is plantar fasciitis. Has anyone ever had this or heard about it? Yep. So what it is you have a band of tissue that makes up your arch on the bottom of your foot. It inserts into your heel bone, and right where that red dot is, that's the most common place where it can get inflamed just because of overuse, repetitive use, standing on your feet long periods of time, not wearing good shoes. So most of the time, the main cause is from tightness. So your Achilles, you have your calf that becomes your Achilles, inserts on your heel bone, and then on the bottom you have the fascia. So it's all interconnected. So because of that, the best thing you could do if your heels are hurting is stretching. So twice a day, take a yoga belt, a yoga strap, a belt, a towel, anything that's not a stretchy rubber band, and take that, and just like the girl in the photo is doing, you want to hold that stretch for 30 seconds, and you want to do that for 5 times total. So, and then twice a day, every day, if you're going to the gym or you're doing physical activity, do it before and after that activity as well. So that if everybody stretched every day, I wouldn't have as many patients, but that would be okay if everyone was not in pain limping. So, sure. I would say you have to listen to your body. So if you can tolerate it, going to the gym is definitely good for you. But if your feet are already really sore and limping, you're exhausted, I would say rest. Even if it's like rest for an hour and then go to the gym. So, and then you can always modify your activities. So if your feet are hurting that really bad, you could do upper body stuff. Yeah, good question. Another thing we see a lot is bunions. Does anyone have a bunion? Yep. So what can you do at home for your bunions? Support them. Wear the good shoes. Wear a wider toe box so that it's not crushing your bunion. Sometimes, though, no matter what you do, it's painful and it requires surgery. So if you have bunions that are hurting you all day long, see a doctor. Okay. We also see a lot of flat feet and high arch feet. So these are some x-rays. The top one is a patient that has very, very flat feet. So those arches are fallen. And that puts extra stress on your tendons and your ligaments and your joints. It's very painful for some people. And then similarly, but differently, high arch feet also puts a lot of stress on your joints and your bones. And they need support as well. So we support them by orthotics. So wearing a good shoe and then wearing a good orthotic. These are actually scanned to your feet. And like you see in the photo, we're correcting that position for your feet. So that would be something you could get from your doctor's office. And then you might be seeing or thinking about it, what about over-the-counter inserts like you see in the CVS or Walmart? What do you think? Are those okay? No? Yes? Say it again? Yes, you do need to make sure it fits you, for sure. It probably not, but in certain situations, it could be better than nothing. So when you go to CVS or Walmart, you see those inserts. If it's floppy, if you can take the arch that it has and you can flatten it, then if you're standing on that arch, it's flat in your shoe, so it's not going to give you any support. If it's more rigid and you're standing on it and you can't flatten it, it's probably a good insert, and that would probably be better than just the shoe insert. Okay? All right, moving on to foot hygiene. So, probably all of you have pretty good hygiene. You're probably learning a lot from from school about having good hygiene, but everybody forgets about the feet. So when you're taking your shower, there was a study that said, I think it was 50% or a very high number of people just let the soap wash down to their legs. They don't actually wash their legs or their feet. Don't do that. You want to actually thoroughly wash your feet and in between the toes with suds and soap and water. And then afterwards, you want to dry between your toes especially. So dry your feet with a towel. I found this on Amazon actually. It's called a toe towel. So it's a long-handled stick with a little towel on the end, so you can floss between your toes. So whatever you got to do, just keep your between the toes nice and dry. You also want to wear socks. So sometimes I've seen patients that have like a flat shoe and they'll just wear it with no sock. But you want to have a barrier between your foot and your shoe to absorb some of the sweat and have a barrier there. So wear your socks, change them out. If you're changing them out, change them so that you're always got a dry pair on. So if that's 2 or 3 times a day, if you have sweaty feet, that's okay. We just want dry, clean socks. And then rotating your shoes. So you want to rotate your shoes. Don't wear the same pair every day. Let those other ones air out to the air. All right. So remember, when you're investigating your shoes. You also want to investigate your clients. So you're going to see patients. They're going to have all kinds of things. And so I'm going to educate you a little bit on what you might see and what you might need to tell them, hey, you might want to see a doctor for this because this isn't normal. So just as a warning, there might be a few graphic photos. So if you're squeamish, just brace yourself a little bit. All right, so ingrown nails. I see this all day, every day. The most common cause of an ingrown nail is, and the picture in the middle is a patient that had that for 6 months. So they were suffering for a long time. So that's sad that it took them a while. So the most common cause is not cutting the toenail straight across. So please, please, please cut your toenails straight across and don't cut back at an angle, because what happens is it can split off and start growing in the skin. Don't dig out the ingrowns. If you have an ingrown, see a doctor, because the more you try to dig in the side, the more you're creating more of an ingrown and more inflammation. I put the picture, that's the device we use to measure shoe size, because if you're wearing too tight of a shoe, that can put extra pressure on the nail, and that can cause an ingrown as well. Any questions with ingrowns? Okay. All right. Sorry? If you're going in a straight line, that's good. But if you cut it back, that can create an ingrown. Okay. You might also see a patient or a client with a subungual hematoma, which is blood under the nail. So especially patients like they are doing a lot of sports. This can be, if it's a little bit of discoloration, it'll probably grow out on its own, but occasionally I'll get some that actually have more damage underneath. So they could have a fracture issue underneath. So if you see this, you might want to tell the client, hey, you might want to see a doctor because this isn't nail polish and it's not normal. So, all right, moving on. Onychomycosis. That's a big fancy word for fungal infection of the toenails, or it can affect fingernails. But this we see also all day, every day. It can be many forms. Mild cases is like a little bit of whiteness. It's like a little bit of, discoloration of the nail, all the way to really, really thick nails that start to crumble and loosen. So, also we see athlete's foot, which is a rash. It can look like dry skin, flaky skin. It can look like the whiteness you see between the toes. So that's why we want to dry between our toes. And if you see these, they're caused by the same fungus. So some things you really want to do is make sure you're following your protocols that I'm sure you're learning. You want to sterilize any instruments that can go into the autoclave. You don't want to share instruments with anyone. Don't share nail clippers, shoes. And if you see any of those signs of infection, let them know to see a doctor because that can spread to your other clients. So you don't want that. You don't want to go barefoot, especially in a public gym or a shower. Always wear a water shoe, clog, something so you're not going barefoot. Don't work out barefoot. I had a patient working out barefoot, and I was like, please don't do that. And then we talked about socks as well. You want to disinfect those and your shoes. Plantar warts is another one. It might look like just a callus or something you just want to shave off, but it keeps coming back, and it might bleed as well. So if you see that, you really want to get that patient to a doctor. We have a special treatment, uses microwave energy that will help kill those warts, which I forgot to mention, it's caused by a viral infection, HPV virus. So you want to not go barefoot because it is contagious. You can spread it to other people. And that's how that works. Okay. So sometimes you might see a patient with more than that. If you see a patient with any of that, which are wounds, if you have diabetics or patients that have nerve damage to their feet, this can turn into something very, very dangerous and bad. So you want to make sure that if you have this or someone you know, get them to a doctor immediately. This is really graphic, so just brace yourself here. So this can turn into this, where you can actually lose part of your foot. So I'll move on to, sorry. All right, so this is our laser treatment. We use it for those onychomycosis nails, fungal nails. We also use it for tendinitis, Achilles tendinitis. This is a nice treatment because the laser treatment, if you've ever seen those LED masks for the skincare, it's like that, but the laser works deeper, so it's more powerful. And it works, we use it for helping to calm that inflammation down by exciting the cells. And also for scars as well. All right, so that's an example of a nail that we treated with the laser. And then we have a bunch of other conditions we treat, fractures, ankle sprains, all kinds of different things. We do custom orthotics. So if you have any foot or ankle issues, just give us a call. So do you have any questions? Let me get to the last slide. And that's me. Oh, question? Uh-huh. would say so. So the question was, her mom had a foot deformity that it was back, the foot was back. Gotcha. I would say that would, yes. Sure. Uh-huh. You can pull, like a cramp. So anybody can have so the question was, is cramping in the foot with flat feet. So anyone can have cramping with their feet, whether they're high arch or low arch. But because you have a flat foot, more stress goes through the arch and the tendons. So it's really important to have the support to reduce that. And then the cramping also, wearing a good compression stocking helps with that as well. Mm-hmm. Any other questions? Mm-hmm. So, do you know where the bone was, the extra bone? Was it like on the side like that? Okay. So the question was, her sister has has an extra bone in her foot, and they prescribed orthotics, and she's still in pain and wondering, is that enough, or is there other treatments for it, right? So sometimes people do have extra bones in their foot. Sometimes they can be totally normal. They don't have any issue, and they're just something we accidentally or incidentally discover on an x-ray. But sometimes they can be very painful, and sometimes we do have to surgically remove those. It just depends on the patient and their symptoms. But I would say that if it's not going away with the orthotics and the shoes and the boot and everything, then you might have to take another look, and it might need surgery to take that bone out. Mm-hmm. Sure. So you want to look for shoe. So the question was, she has high arches, and she wants to know what kind of shoe recommendations would be good to support her feet. So shoes, especially for high arches, it can be difficult to find a good shoe. You want to look for a shoe that is made for a supinator. So supinators have a higher arch. Your arches are going up. So different brand recommendations. There's a lot of good ones. Saucony is a good one. Merrell. But really you have to just try them on. And you want something that is supportive. But sometimes, especially the rigid orthotics, are too rigid for a high arch. So you want something like a soft top cover over that. Yep. Yes. So sure. I need to replace mine too, actually. So Hokas are great because they're a good supportive shoe. They have a really thick heel counter, but you don't have to get Hokas. So I'm not a brand loyal doctor. I would rather you evaluate and what works for you. Because my boss, he doesn't like Hokas. He likes Brooks. Hokas weren't comfortable for him, and Brooks were awesome. And I have Hokas on today, but I've also had other brands as well. So it's more about finding what's good for your foot. Any other questions? Oh, yep. Sorry. Uh-huh.
there's like regular changes in that, and just like how that I got rocks to kind of just like walk around the house and do some exercises. Have a good recommendation on what to do. You can't wear compression socks with skates.
Okay.
Like what else?
It's hard for skates because you can't do much about that rigid shank in it. But just whenever you're able to not be skating, any kind of good shoe, they make like the recovery sandals, something that's supportive but also soft on the upper layer. So yes, so there's different sandals. The mid part of the shoe is the highest part, and it offloads the heel a little bit. So like OOFOS, OOFAS, and I think Hoka has one. So that might be good on the downtime when he's not. And then just make sure he gets his shoes measured so that he's wearing the correct size in regular shoes and the skates as well. Any other questions? Oh, yep.
How much to like determine if your shoe maybe is like slightly too big or fits? How much space should there be between like the tip of your shoe and your toes?
Very good question. She's asking, and I forgot to mention this, when you're buying your shoes, how do you make sure that that shoe is fitting? How much space should there be at the tip of the shoe from the tip of your big toe? I like to say about a half or a full finger's breadth from the end of the toe to the tip of the shoe. Mm-hmm.
What if your second toe is significantly longer than your big toe?
Great question. So most people, so her question was, what if your second toe, the toe next to the big toe, is longer than your big toe? And that's common for, I would say more people have a longer second toe than the big toe. And if that's the case, then you measure from that longest toe. So a finger's breadth from the second toe. Mm-hmm. So that's a very good question as well. If you have weak ankles or ankles that you feel need more support, what kind of shoes? So I would recommend something higher, like a higher top tennis shoe, or like an ankle booty, something like that to give you more support. Some people, though, that is irritating. So if that's not you, you might try like a soft ankle brace or even taping, like athletic tape around your ankle if you know you're going to be standing a long time. Mm-hmm. All right. Well, thanks everyone very much. I hope you learned some things. I have some business cards, so if you ever have an issue, feel free to call our office, stop by, and good luck on your careers. I know y'all will have a really great career, and good luck.
Thank you all for your participation, the questions, the answers. If you have any other questions, like she mentioned, there's business cards up here where you can grab one. She's like not too far down the street, so you can always visit as long as you have the point. So have a wonderful day. See y'all later.